Hey everybody, Dr. Bobby Saenz here from San Antonio, Texas, and really excited to talk to you about the iLink procedure, which is a cross-linking procedure, corneal cross-linking procedure for progressive keratoconus. And so we're going to talk to you a little about, in this session here, what is the iLink procedure and who is it for? So we'll start here with the indications that you'll see here, and here are my disclosures. And let's first start talking about the keratoconus journey. Really in keratoconus, if you ask what's the worst thing that can happen in keratoconus, it's really the patient progresses, right? The cornea is thin, it's weaker, it bulges, and essentially you need a corneal transplant. And when I think about really cross-linking, when I think about keratoconus, like my whole goal in this patient journey is really for them not to end up in getting a corneal transplant. So the question is, how do we prevent these patients from getting a corneal transplant? We cross-link them and we make the cornea stronger. So when we look at, what is the estimated prevalence of keratoconus? In school, we probably all learned the 1 in 2,000 number. But I think what we're seeing is as technology is getting better, what we're seeing is the ability to diagnose it earlier. And we're getting more suspicious. We're running more topography when we see, irregular astigmatism or maybe more astigmatism. So if you see a plano -6 before you think, can they get LASIK? We're thinking, do they have keratoconus? Recently, there was a study out of the Netherlands that showed, 1 in 375. There have been even some studies out of Australia that have showed that's even more prevalent than that. And so I think it's going to be really interesting as we now have this newer technology, like, for example, epithelial thickness mapping. For those of you who are not unfamiliar with epithelial thickness mapping, that's where we can actually use the OCT. So if you don't have a topographer in your clinic, you can actually use the OCT. Certain models have this where you can actually image the epithelium of these patients. And what you'll see is over the cone, what you'll see is the epithelium actually thins. And so I think that this has been a big game changer. First we had, inferior steepening, and now we're seeing posterior float help us. And that's helpful if you have an image, if you have a device that can image the posterior float. But oftentimes those devices can be expensive. And now we have OCT, which is normally in optometry offices, that we can use to diagnose keratoconus. So this is great because we know, right, from the Survey of Ophthalmology in 1998, 1 in 5 patients are going to need a corneal transplant. So we want to get that as low as we can. If we could get that at a 1 in 200, 1 in 400, it's going to be a lot better. And so I think that we see, I think it's, amazing that Steph Curry has keratoconus and can shoot the way he can. Like, I just think it's unbelievable. But you see athletes, like there's more prevalence, there's more awareness that's coming to keratoconus. We're starting to see a lot more people, with the Google searches, we're starting to see that increase. And really, I think as optometrists, what we need to realize is, yes, we know that keratoconus usually begins in the teenage years, but we need to now know that there is an FDA-approved option, the iLink procedure, for these patients. So we talked about the early, the importance of the early diagnosis. And I think, it's great that we now have specialty contact lenses. We have scleral contact lenses where it really allows us to, correct the vision in these patients where maybe we would have done a corneal transplant sooner. But now that we have all these advanced features on scleral lenses and using the sclera and measuring toricity, I think that we're going to get less corneal transplants because we're becoming better specialty contact lens fitters as a group, as optometry as a whole. And I think the other thing that we're seeing is we're seeing a lot more, we're seeing way better insurance coverage for the iLink procedure, which we're going to talk about in just a second. But those two things, being better fitters of specialty lenses and also being more aware that the iLink procedure or cross-linking is a great option for progressive keratoconus, I think we're going to see that corneal transplant, the amount of corneal transplants come down. And that's our whole goal, because these patients, it's very difficult to manage these patients. We have a patient right now who has very bad keratoconus, and they've tried like every single different type of specialty lens. They've tried every different type of solution, and this guy just has the reddest eyes, 4+ injection. And he's tired of going to work and saying, like, everybody asking him, like, why are your eyes red? Wink, wink. And so he's looking like, is there anything surgically that can be done? And really, if we would have just caught him early and cross-linked him early, right? This gentleman who's in our clinic who, like, he was just like laying it all out there. He was just talking about, like, man, Bobby, you just don't like realize, like, my whole life, what I'm thinking about right now is like, how do I get my eyes less red? Like, I'll pay whatever it takes. and just hearing him as a teacher, as a dad, like what he has to go through, it just really, like, for him, it's like, how do we diagnose keratoconus early, and how do we recommend, this iLink procedure? So, because if we can do that before their vision's lost, I mean, if we recognize, keratoconus when they're 2025 and we can cross-link them, right, then that allows them to stay 2025 for the rest of their life. And so I think that we've seen the benefit, and now again, having an FDA-approved procedure here on the bottom here, this iLink procedure, what we're gonna see is that I think sometimes optometrists may get a little nervous, like, oh, if I do cross-linking or I do an iLink procedure, I'm not going to fit as many specialty lenses. And it's like, no. We have to change the mindset in keratoconus. In keratoconus, we used to think, oh, they'll just progress when they're young. And really, we have to treat it more like glaucoma, where we're checking throughout their whole life if there will be progression in these patients. But the other thing, just like in your glaucoma patients come in and you're checking, are they progressing? And then the number two thing that you're doing is you're rehabilitating their vision. You're checking, do they need glasses, contacts, or some kind of surgery to correct their vision, right? We're gonna do the same thing with keratoconic patients. We're gonna check, number one, are they progressing? And then number two, we're still gonna have to correct their vision. And whether that be with glasses, soft contact lenses, or a lot of the times, specialty lenses. So let's talk about this iLink procedure, because there's still, we've done a lot of these webinars where we're just trying to increase the awareness, and still there's a lot of optometrists who are unaware that there's an FDA-approved option. And here we call it the iLink procedure. So this procedure, is an epi-off procedure. So what we're doing is we're removing the epithelium, and then you can see here on the bottom left, the FDA-approved procedure is with Photrexa and Photrexa viscous, and that's riboflavin. So these riboflavin drops is going into the cornea, and basically the epithelium has been removed. We're putting these drops on the front surface of the eye, and then once we've seen that Photrexa has penetrated, usually it takes about 30 minutes. Basically, we then use the UV light to strengthen the cornea. Again, that process takes about 30 minutes. So if I had to summarize it and simplify it, epithelium off, we get the riboflavin, and then we lock it in with the UV light. Now, the great thing about the iLink procedure is that there's a 0-day global period, which means that optometrists, if you work with a surgical group, we can co-manage these patients. And there's a 0-day global period, which means it doesn't get really difficult, like cataract surgery, like what modifiers do I do? You can just bill your 99 or 92 codes for these patients. So if the patient chooses to go back to you for these post-operative visits, you're actually seeing them not as a post-op, but actually as medical follow-ups. And so it can be beneficial for the patient, because we prevent the progression of keratoconus. It's beneficial for surgical practice because they do more surgery, which they like. And then it's beneficial for the primary care optometrist because they're seeing these patients, they're checking to make sure, basically you treat this like PRK, heal the epithelium, and then they're on a steroid taper. And then once everything's healed, then afterwards you fit them again in specialty lenses. So it's really rewarding. I think one of the biggest thing here is just knowing that, with cross-linking, there is only one FDA-approved procedure. Sometimes you'll hear about people doing a unapproved cross-linking. And I think it's just something as optometrists, we should be aware of where we're sending these patients, because if you are sending to places that does unapproved cross-linking, you just got to be careful there, because that carries certain risks. We've talked with, some of the legal consultants that we do. And I think that's just one thing I've learned being in this setting here is just, we have to be aware of that. And I don't think that's anything that gets taught in school, but the benefit of referring out for the FDA approved treatment is that you get to send somewhere that there's also insurance coverage too. And so that's beneficial. We've had patients get cross-linking for pretty much $0, $0 to $300. I think in Q4 of last year, the average patient payment was only $324. So not saying it's like that all the time, but it's great now having a treatment that the patient can go for where insurance is going to at least cover a portion of it. So if you're looking, there's a ton of resources online. If you want to look for, what practice does an FDA approved option, you can go here to ilinkexpert.com. One other thing just to be aware of is Glaukos is partnering with Topcon, and they have this program here. Typically when you suspect somebody with keratoconus, you're like, oh, I don't have a topographer, let me just refer out. And really that's because topographers have cost, $25-ish thousand or more. And really they have a program here where you can get it close to almost like 1/3 of the price of a topographer. So if you're interested in that, reach out to your Glaukos or TopCon rep. This really gives you the ability to topography. You can do some dry stuff like non-invasive tear breakup time and mybography at a price point like this. It's really going to increase the access to optometrists to have more topography units in their office. So with that, guys, thank you all so much. I hope you all have a great rest of the meeting.